Alright, today I'm going to talk you through how to use an incentive spirometer. Incentive spirometry is a form of lung volume expansion that's used by respiratory therapists to help increase the volume of the lungs in patients. So before we come in and begin our treatment, we need to introduce ourselves to our patient and explain to them what we're doing. And we need to use a respirometer. We need to see what our patient's tidal volume is and what their inspiratory capacity is to see if they're going to be a good candidate for IS. Then what we need to do is look at the goal for our patient based on their height, their age, and their gender. And once we have that goal set, we can use this little yellow marker to mark our goal. And then what we need to do is assess our patient. We need to get their vitals, we need to listen to their breath sounds, and we need to instruct them on how to use the incentive spirometer. So, I'm going to have my patient exhale completely, and then I'm going to have them wrap their mouth around the mouthpiece nice and tight. I'm going to tell them to inhale slowly and deeply as much as they can. And then when they can't inhale anymore, I'm going to have them hold it for 3 to 5 seconds before they exhale. And I'm going to instruct my patient that the breath hold is the most important because that's what's going to pop open those alveoli and prevent atelectasis, or the collapse of the alveoli, so they're going to be able to breathe better. And then what I'm going to have my patient do is watch the float and see if they can reach their goal. So this white float will float up as they breathe in, and this will also float, and we'd like to keep this between better and best, and we want to get that as close to our goal as possible. Now with fatigue, it may take our patient a while before they can get their goal, and that's okay as long as they're working towards it. We want to make sure our patient can reach at least 1/3 of the predicted normal, which is what their goal is set at, and we're going to have our patient do this about 10 times every hour, and that's going to help prevent atelectasis. So the most important part is the breath hold, and then we want to see our patient meet those goals. So we're going to just have them keep working toward those goals, practicing often in order to prevent atelectasis, and that's how you use incentive spirometry.